We're seeing incredible growth in Western Sydney at the moment, and a particular need for cardiovascular support with that disease state, and it's quite prevalent. It's estimated that that population will go to 6 million by 2041. We applaud the government for a number of the different hospital expansions that they're investing in, and also a number of our private operators. We're seeing a lot of our private operators build greenfield clinics, and they are putting the high-end technology that you would get in a tertiary institution into those geographies.
The workforce in Australian healthcare has a significant shortage, particularly in radiology. We have a shortage of radiographers and sonographers and MRI technicians and nuclear medicine technicians. In the past, we were only able to produce the most complex studies if we had the most experienced radiographer or MRI technician, for instance. New technology coming out. As a business, we're constantly investing in the newest technology. We have a CT scanner that's the first in the Southern Hemisphere, and the focus is on this developing technology to produce consistent, high-quality studies that is not dependent on the most skilled technician. My name is Mansoor Parker. I'm a diagnostic and interventional radiologist, working predominantly in private practice in Sydney. I'm the founder of a group of practices called Quantum Radiology throughout Western Sydney. I sit on the board of the ADIA, the Australian Diagnostic Imaging Association, and am a committee member for the Australian Government for MSAC, which is on imaging health and safety. I am a member of the Interventional Radiological Society of Australasia and also the Australian Musculoskeletal Group, AMSIG. It's an interesting question because Western Sydney is quite unique. It is a cultural melting pot. Traditionally over the years it has had a shortage of high quality healthcare, and throughout this period, in fact the reason I started radiology practice in Western Sydney is, having lived in the area, found it hard to get access to imaging, particularly things like MRI or interventional. So the need for the population often transcends just access. Often it is also language barriers, providing staff that are multilingual, providing cultural sensitivities where you are able to provide privacy in these situations, but also giving them a level of healthcare that they would get anywhere in the world as the highest quality.
I'm Berkovich. I'm the CEO of GE Healthcare Australia and New Zealand. I lead a team and serve a team of around 450 team members. Some of those do support the wider Asia region, but predominantly the Australian and New Zealand market. I operate a number of different businesses. We have a very large imaging business, our ultrasound business that covers all modalities, as well as a patient care solutions business, which is all the anaesthetic and monitoring equipment in a hospital. We also have a contrast business. That's the contrast agents that are put into patients while they're getting their SET scans, and I support that team whilst it does report independently. Supporting all of that is our service business. So we have a large service team, hundreds of engineers looking after our equipment through the life of those assets, and obviously all of our support functions in the region, HR, legal and finance. For the last 4 years in a row, we've actually led the industry with the number of AI patents, particularly in our imaging business. It's been well adopted in Australia. Being a mature market, we have a lot of our clinicians wanting to bring the latest technology to the market and cover all geographies. We're seeing incredible growth in Western Sydney at the moment, and a particular need for cardiovascular support with that disease state, and it's quite prevalent. It's estimated that that population will go to 6 million by 2041. We applaud the government for a number of the different hospital expansions that they're investing in, and also a number of our private operators. We're seeing a lot of our private operators build greenfield clinics, and they are putting the high-end technology that you would get in a tertiary institution into those geographies. That provides greater access for patients at the end of the day. So the more technology, the more that clinicians are investing in those geographies, we can provide and be part of that provision of services to those communities that need it.
Diagnostic imaging has struggled to get government funding and indexation. More recently, the government has given us, in the diagnostic imaging sector, some indexation. However, the problem is that the rising costs and inflation has caused significant pressures on providing bulk billing services throughout the industry. The advancing technologies also provide increased costs with these machinery. The idea or concept of an example of a phone in 1995 being the same cost as a phone in 2025 is if you think about it, the technology, the advancement and the usability of that phone is completely different to what it was in the 90s. This is the same with imaging. MRI and CT in particular has advanced so much and is providing so much diagnostic improvement, early detection of disease compared to what it has done previously. So this early detection does prevent significant costs to the government and to the healthcare industry at large. However, the imaging sector has not had the support it requires in terms of funding through bulk billing, and there are increasing pressures to provide gap payments now, which we're seeing throughout the industry.
There's shortages across the whole industry, and we also recruit from the same pool, and we're also trying to attract clinicians to come and work in our industry. What is enabling the productivity out of that workforce is actually the technology. So more patients can be scanned each day. So rather than hiring more staff and running longer shifts, we can actually achieve better outcomes by seeing more patients during a normal working period. So that gives a little bit of work-life balance for the staff, as well as providing, it's our role to also provide a lot of education to help upskill. We do a lot of work with a number of customers who may be operating several different sites, and they're getting several different types of productivities from those sites. So a big part of our business is with change management and upskilling the workforce to make them more productive. So we'll typically benchmark a number of sites with a customer, and then we'll work on, why is that site potentially underachieving compared to others. We'll help do additional education, maybe change protocols or sequencing, and share the best practices so that everyone's upskilling, and ultimately that gets more patients through the door every day, which is great outcomes for the community.
The workforce in Australian healthcare has a significant shortage, particularly in radiology. We have a shortage of radiographers and sonographers and MRI technicians and nuclear medicine technicians. In the past, we were only able to produce the most complex studies if we had the most experienced radiographer or MRI technician, for instance. New technology coming out. As a business, we're constantly investing in the newest technology. We have a CT scanner that's the first in the Southern Hemisphere, and the focus is on this developing technology to produce consistent, high-quality studies that is not dependent on the most skilled technician. What this means is that we're able to produce studies with staff that have less experience but still producing the same quality. And a lot of this involves AI technology. A lot of this involves the scanner's improved technology to be able to produce these images. Learning how to use this, we're all at the cutting edge. We're all sort of learning on the fly, if you like. Companies like GE provide great sort of support for us by providing their own specialist technicians that provide sort of guidance into how to use this technology. We also have conferences and support educational sessions with companies such as GE that are providing this background support so we can optimize the utilisation of the equipment.